So, I know many people think that you have to have a family history of breast cancer. Did you know that 85% of women that are diagnosed with breast cancer have no family history? Now, I do have a family history. On my dad's side, my paternal aunt and my paternal grandmother did have breast cancer. But really, when you start looking at all my other risk factors, they're really not there. And I know a lot of people think that, oh, I must have to have the BRCA gene, which is a mutation, BRCA1 and BRCA2, which I completely understand, but only 5 to 10% of women have that mutation in that gene. Now, if you do have that mutation, then there will be a 72% increased risk of breast cancer in your lifetime. So it's so important that we look at all these different factors. But I want you to understand that you need to take this serious and you need to be your self-advocate. So whether you're diagnosed with it or you're not diagnosed and it's just precautions, prevention, is all so very important for you. So as soon as I was diagnosed, I said, I already know what I want. I want a mastectomy, I want this out. I needed this out as quickly as it came. I wanted it out. I wanted to make sure that I was gonna be here. And that was very difficult. I probably went back and forth, I think almost every 2 days in changing my mind of what I wanted to have done. But I had to push. I had to make sure that I pushed to have my biopsy done quickly. I had to make sure that I got on the schedule for an MRI with contrast, which you needed to make sure that there were no other tumors anywhere else that they were gonna have to biopsy or deal with during surgery. I had to push for that. I had to go to different locations to make sure I can get in quickly. They also wanted to make sure that when things were abnormal, I needed to have a PET scan done, which is not fun, right? They radiate your whole entire body trying to see if there's any other cells or any other cancer that have metastasized through your body. But these are all critical in your diagnosing and staging of your cancer, which will then later on change what you're gonna have done. So all of these things are so important. So you need to make sure that you get all this done, and you need to make sure that you follow through. Do not wait. Do not wait 6 months. Do not wait a year and ignore any breast tumors or any kind of masses. You need to have that checked. The earlier we can find out this diagnosis, the better your treatment is gonna be long-term. So I ask of you to keep doing that and following through.
So thank you so much for sharing this, luckily very short journey for you.
Yep.
I know it'll be lifelong, but thank goodness everything was handled pretty quickly. For myself at home, what can I be doing now to basically be on top of or prevent any future issues for myself?
Well, besides making sure that we get our mammo every single year, and if you're at risk, and making sure you get it every 6 months, self-breast exams are really the key. And I would say, because it's gonna change, especially if you have fibrocystic breasts or you have heavy periods, your breasts may feel a little bit different before your period, during your period, or after. So I would say pick a time. If you say the 5th of every month is when I wanna do it, then the 5th of every month, you set your calendar. I put everything in my appointment, including my gym time now. Like, I make sure everything's in my calendar. So if you say the 5th of every month, I'm gonna do my self-exam, I think the best place to do it is in the shower, soapy water, hands, glides much easier. I usually want to start, and you can start from out to in. I usually like to start in the middle. You want to feel all the way around the areola and then tap and smooth all the way around, almost like a little target sign. You're going all the way around, and do not forget to go all the way in the lateral breast. That breast tissue goes into the axilla, under your arms, and that's where my cancer was. You have to make sure you follow all the way through, and you will be the one that knows if there's a change, right? You'll know fibrocystic breasts, you'll know ones that are always there, they've been examined, they've been okay. Anything new, anything surprising, any nipple discharge, that's all abnormal, and you really need to get that checked immediately, not waiting to see if it changes each month. You need to get that checked and get on that, because it can sometimes take a month to 2 months, 3 months, as you know, to get on the calendar and to get things done in your life, but you need to make that a priority.
Great, thank you so much.
You're welcome.